Iowans. These are Iowans who care for our parents and our grandparents in nursing homes. These are Iowans who care for our kids and our adults with disabilities. These are the Iowans who work at convenience stores and retail shops throughout our entire state. They are the working poor. They work. They just happen to earn a low wage and happen to work for an employer who doesn't offer health care, nor can they afford to buy it on their own. That's who we're talking about tonight. This legislature and this governor will not ignore the opportunity to bring the security of health insurance to tens of thousands of uninsured working Iowans. We agree on that. This legislature and this governor will not take a pass on controlling health care costs. We agree on that. This legislature and this governor will not miss the chance to refocus health care on prevention and wellness, or the chance to pay health care providers for the unpaid care they currently provide. We agree on that. Because today in Iowa, our hospitals face $1 billion in uncompensated care. Research indicates that Iowans pay an additional $1,000 a year in insurance premiums to cover some of the costs of uninsured Iowans. Some have called this a hidden tax. Don't fool yourselves. We are paying for it. Those of us who are fortunate enough to have health insurance. We are not here tonight to debate if the number of Iowans living without access to health care should be reduced. What we are here tonight to do is to decide how to get it done. Senate File 296 has many provisions that the governor's office and the Senate agree on. For example, we agree to focus on wellness and prevention. We agree to move away from fee-for-service. We agree to pay health providers to keep people healthy and change our health care system to a system of wellness rather than a system of sickness. We agree. We agree. Senate File 296 includes the governor's innovation language, the innovation grant language. We, like the governor, believe in an integrated care system, and we agree that moving to outcome-based Medicaid is the way to go. Governor Branstad has repeatedly said he doesn't believe the federal government will keep its financial promise with regard to Medicaid expansion. You know, it's well worth noting that the federal government has never failed to meet that obligation in almost the 50 years that Medicaid has been in existence. But it's also worth noting that Medicaid expansion under the Affordable Care Act has already been budgeted. It has already been allocated to the states. It was enacted during the pay-as-you-go rule. And if that is not enough, ask this question. How, if the governor's is the governor's concern alleviated by asking the federal government to fund 60% of a new, yet-to-be-designed, Healthy Iowa plan? Federal costs exist either way. What's more is that the governor's plan will ask Iowa taxpayers to pay again to the tune of about $162 million annually versus zero under Medicaid expansion. We've already paid for it. Iowans get the biggest bang for their tax dollar by expanding Medicaid. Nevertheless, in order to respond to the governor's concerns, during this debate, we will amend this legislation to include a compromise on this point. Following the lead of other Republican governors, Iowa will be able to reevaluate our participation in the Medicaid expansion if the federal government does not keep its promise. We will be offering an opt-out amendment. So here's a brief summary of the bill before us. It allows working Iowans between the ages of 19 and 64 to enroll in the Medicaid program if their incomes are below 138% of the federal poverty level. That doesn't make much meaning to most people, but this is what it means. It means these are Iowans who, if they are single, are earning $15,800. Or if you are a family of 4, you are living on $32,400 a year or less. That's who we're talking about. They aren't people who are trying to game the system. They are our neighbors and friends, and they have a face, and they are the face of the people who are working in our nursing homes and our residential care facilities, and the list goes on and on. The benefit package will be the very same as the current Medicaid program, which I might add keeps administrative costs very low, 3 to 5%. Private insurance, right now anywhere 35 to 40% administrative overhead. Under the Affordable Care Act, even the private sector is going to have to start reducing its administrative costs not to exceed 15%. That is in it as well. Senate File 296 moves all Medicaid provided services to an integrated care model, a more holistic approach to delivering health care. The focus again is on prevention and avoiding expensive future treatments. Supports will be used to remove barriers to health services and to promote healthy choices. And I am off fingers here all of a sudden. The Department of Public Health and the Department of Human Services will develop reimbursement rates that reward providers for helping make Iowans healthier by creating financial incentives that focus on quality outcomes and personal responsibility. In addition, there is also a legislative advisory council that will be created to guide and oversee the creation of that integrated care model for Medicaid. And because building a healthier Iowa and a stronger state economy requires reducing long-term health care costs for everyone, this legislation also creates a legislative commission on integrated care. This commission will make recommendations on accountable care organizations and approaches using value-based financing and emphasizing person-centered, coordinated, and comprehensive care. Members, I believe that the governor's office really wants to sell our state, and it will be done and be much easier and much more enhanced by this legislation, because we know that healthy workers are more productive and cost less to employ. At the end of the day, I believe Iowa will participate in Medicaid expansion. I believe that because I know we are not going to turn our backs on 100,000 uninsured working Iowans. To continue the pointless partisan bickering when we have an opportunity to improve the lives of Iowans is the right thing to do tonight. Stop the partisan bickering. This is not about a Democrat or Republican or an independent. This is about our friends and neighbors who work every day, pay by the rules, and simply are uninsured. With that, Mr. President, I would like to yield the remainder of my opening remarks to the senator from Polk, Senator Hatch.
Senator Hatch, you are in order.